All right, so good morning, everyone. I'm Dr. Caroline Taylor Walker, and I'm here talking from Heroes Home Doctor. Now, today we're really lucky to have with us Mel. Mel works in Torquay and with us at Ministry of Skin as a functional nutritionist, which is really fantastic to have her. Now, she specializes a lot with hormones. So today we thought we would just discuss a little bit about the perimenopause, which is an area that as GPs we do struggle a lot with options available. So Mel can really help during this time with some non-medical ways to help make you feel a little bit better. So good morning, Mel.
Hi.
Hi, how are you doing today?
I'm good. How are you?
Yeah, good, thanks. Thanks for joining us. So yeah, Mel, I thought I'd start by asking you what is the perimenopause?
Yep. Perimenopause is, I like to call it reverse puberty because it's a time of transition. So in puberty, like we're getting used to having our hormones, perimenopause is where we're getting used to not having our hormones in the right balance that we normally do. So it's a tricky time, and it can be a tumultuous time for some ladies. We can get really symptomatic. But it normally starts happening in our early 40s. And then once we hit menopause, which happens around 50, then it stops. But menopause is the cessation of having a cycle for 12 months. So once you haven't had a cycle for 12 months, then you're in menopause. But that time leading up to menopause is called perimenopause.
Yeah, I like that term. I see that myself in patients as well. You've got that like almost like that graph. So when you're going through puberty, your hormones are going up, then you're well, then we're now going with the hormones going down. So what are some women, what are the kind of characteristics of the perimenopause? What symptoms will women be getting?
Yeah, there's quite a lot. I think you hear those symptoms go along with menopause, but it's actually perimenopause where we get most of these symptoms. But things like hot flushes, a heavier flow than what we normally have, shorter or longer cycles, or both, weight gain, weight resistance, low libido, headaches and migraines, sore breasts, night sweats, and then insomnia and not sleeping as well as what we used to.
So time to look forward to then.
I don't want to scare people off, but
yeah.
I mean, some people glide through perimenopause and don't have hardly any symptoms at all. But then there's the other extreme where we get all these symptoms, and some women really suffer, and it really does interfere with their life. So it depends on the individual, and it depends on kind of what you've done in the past as well, and if you've got any other underlying conditions going on as to what your symptoms are going to be like.
Yeah, definitely. So why do these symptoms start? Where do they, what changes in the women?
Yeah, so it's a change in our hormones, and the hormones I'm talking about mostly are progesterone, estrogen, and testosterone. So our progesterone starts to decline because we're not ovulating as much. So we're not ovulating necessarily every month. And if we don't ovulate, then we don't produce progesterone. So then we get a low progesterone, and we want progesterone to counterbalance estrogen. So progesterone is like the grandma hormone, I call it. It kind of comes in and it calms everything down, soothes everything. And when we don't have that in the right amounts, that's when we can get symptoms like anxiety and depression and sore joints and muscles, because it's an anti-inflammatory hormone as well. So so progesterone, as progesterone declines, this is where we start getting some of these symptoms.
Sure. So what about estrogen then? People obviously are aware that estrogen's around as well. Can you tell me a bit more about that at this time?
Yeah, estrogen gets a bit of a bad rap, doesn't it? But I like to call it the naughty child hormone, particularly in perimenopause, because it's all over the place. So it can be up, it can be down. We can have higher estrogen than we've ever had before, but generally it's on the decline. So yeah, this is where we can get symptoms of low estrogen, such as such as heart palpitations and dry vagina and low libido. And then in the same cycle, we can get really high estrogen because we're not metabolizing our estrogen out properly. So we can get breast pains and the heavier periods and things like that. So it's a delicate balance between estrogen and progesterone. But gradually, in menopause, we will have lower estrogen than we've ever had before. But in that perimenopause phase, it's up and down like this, like a roller coaster.
Yeah. I often say to people it's like a microwave or a bit of machine that's failing. You know, some days you just turn it on and it's perfect and it runs really well. And then later on in the afternoon, you've got to smack it a few times to get it working. And then other days it just will not work at all. And it's, you know, you just cannot control what it's going to be like on any single day, really.
And that's where you get women going, I just feel crazy. Like I feel like I'm not in control of my emotions. And you kind of not, because this is what's going on internally. Your estrogen is all over the place. So it does give you those crazy moments and irritability and moodiness.
No, it's interesting. Why do we get these fluctuations in the estrogen?
So estrogen is on the decline, but our body doesn't necessarily want it to decline. So like estrogen knocks on, FSH, which is follicle stimulating hormone, is produced by the pituitary gland. And that kind of knocks on the ovaries door saying, wake up, we need more estrogen. And then estrogen, and then it doesn't happen. It doesn't respond. So then we have the low estrogen, but then all of a sudden we do respond and we get that surge, and that's where you get the high estrogen again. So it's our ovaries not really producing as much estrogen as what it should.
Yeah. So they're those that failing microwave. So
yeah.
The ovaries not working well.
Yeah, and if you did want to know, then it's just a simple blood test to measure FSH, isn't it? Just to see if your FSH is increasing, then you're in perimenopause, and when it's really quite high in double digits, then you are menopausal.
Yeah, it's quite hard on our side, and you're pretty aware as well that the bloods often, people really want bloods. They want the bloods to show that they're in these stages, but sometimes the bloods can come back normal, and that can make you feel even crazier that you're getting all these symptoms, that your bloods can be normal. And when you described earlier that the hormones are literally going like this, that we can get people when the hormones, they say this is normal and they're going up and down like this, you can actually take the bloods here when they do come back as normal and they don't truly reflect what's going on. So, you know, the symptoms in this stage are really important.
Yeah, absolutely. And then the other thing with bloods when we're testing hormones as well is you really need to know at what stage of the cycle people are in. So you need to know whether you're mid-cycle or in your luteal phase or follicular phase. I often get women come in with their bloods and they've got no idea when they took them, and it's like, it kind of becomes irrelevant because progesterone are like that throughout the whole cycle. So yeah, just a tip to know exactly when you are, where you're at in your cycle when you get your blood.
Yeah, so when they get it done, just know what day they're on. Yeah, it makes a big difference.
Yeah.
So you obviously gone over some of the complaints, but can you tell me more about some of the more common complaints? So one of the ones that we hear a lot of, and I suppose women don't like, is weight gain.
Yeah, this is a really common one I see as well. And they say, I'm not doing anything different. I haven't changed what I'm eating. I haven't changed my exercise habits. I'm maybe even like trying a little bit harder. And they're getting this weight gain, particularly around the belly. And it's really stubborn. No matter what they do, they can't shift it. So it's actually a protective mechanism. So as our estrogen is declining, our body doesn't want it to decline because we need estrogen for bone health and brain health and overall health. So our body helps us put on fat because fat produces estrogen. It's a different kind of estrogen. It's estrone, so it's not as strong as estradiol, which is our predominant estrogen in our premenopausal years. But so that's a protective mechanism because our body does want us to have a certain amount of estrogen in our system for protection.
Okay.
And then I guess we have other components that come into it, like stress. So the stress hormones like cortisol and insulin that can come into play that can help us have weight resistance and weight gain too.
Yeah. And you mentioned stress then. What about stress at this time during the perimenopause?
I mean, it's women in our 40s. How busy are we? we have we have young kids or teenage kids. We are probably contributing into the family financially. So we're back into the workforce. We're managing the house. We're cooking, we're cleaning. We're trying to keep ourselves fit, trying to look good. We're trying to stay connected and have meaningful relationships with our husband and our friends. And then we may have aging parents where they need more support as well. So we have a whole lot going on, and all this while our hormones are like up to mischief. So if we have all this stress going on, our body is producing the stress hormone cortisol, and then that can affect our weight as well.
Yeah. And interesting on that side as well, the way the hormones are made up, you've got your ingredients at the beginning and they all go along the same kind of pathway. And then some of those ingredients go down to make cortisone for stress, and then the rest of it go across and make our female hormones. So you can have this kind of cortisol still, where the ingredients are used to make cortisone, the stress ingredients, are not made the female hormones. So the stress can, as you're fully aware, exacerbate the drop in hormones too, and all these symptoms.
Yeah.
Don't realize how important stress is on our lives.
Yeah. So I often tell my patients that stress will be made at the expense of progesterone. So if you want really good levels of progesterone, which is a really important hormone to balance out that estrogen and to be less symptomatic overall, and to have that calming way about you, then we need to really dial in the stress management, which we're going to go into more detail a bit later, but that's really important.
Yeah. So the other really common symptom that I hear a lot about is night sweats or hot flushes. Could you tell me a bit more about those?
Yeah, again, that's the change in hormones. So the imbalance between estrogen and progesterone, but also the imbalance between estrogen in itself in that same cycle. So people who have the most night sweats have the biggest drop in their estrogen. So it all either soar really high and then drop down really quickly, and that's where they get the night sweats. And it's your body's not, it's like a thermostat, and that thermostat is out of control when we have that estrogen fluctuation.
Yeah. Okay. The other thing that's quite common during this time is heavy periods. So why does this occur?
Yeah, again, it's because of estrogen. There are lots of good things about estrogen.
Yeah, we don't like this estrogen.
Yeah. I mean, estrogen makes us feel great, doesn't it? If it's in the right amounts, that's when we kind of feel sexy. We've got good libido. It does make us feel great, but it can just get out of hand a lot. So, estrogen builds the endometrial lining, builds and builds and builds and builds. So if we have excess estrogen, or when we're not detoxifying estrogen properly, then we get a thick endometrial lining. And this is when we shed, it's heavy. It's heavier than normal. And if we have lower progesterone because we're not ovulating regularly, then progesterone is not counterbalancing estrogen. So we can get the flooding.
And those balances again. So one of the other hormones we've not spoken about is testosterone, which I think is actually hugely important and not spoken enough about in women. It's something that's forgotten about. So do you mind telling me what happens with testosterone during this time?
Yeah, I mean, people correlate testosterone with the male hormone, but females do need it in the right amounts as well. And it gives us motivation. It really helps with our libido. It helps with lean body mass and a normal weight range. So it is super important. But as we age and in perimenopause, it does generally start to or decline. So by the time we're 40, we have half the testosterone we did in our 20s. So it does decline quite a lot. And if occasionally you can get testosterone surges in this time as well. So if you're in your 40s and all of a sudden you're getting pimples and hair in places that you don't want anymore, this is your testosterone having a surge. So again, it's that balance between all those hormones.
Yeah. Yeah. It definitely sounds like puberty, doesn't it?
It is like reverse puberty.
Yeah. Oh. So, we've gone over all the symptoms which do sound horrific for us women, that we have to go through them really. But the thing is, like, we have to go through them when we do them, but I think it's just not spoken about enough, is it? A lot of women, just take it for granted, or, it's put down to your hormones and as a joke. But there is lots that we can do to make this period of time more comfortable and better and a nicer transition. So it's really important that we're, aware of these things. So what kind of things can we do now to support this time?
Yeah, there's actually a lot that we can do, and we don't have to suffer through. And I don't think people realise that there are lots of natural things that we can do. So the first thing I do when ladies come in and they are symptomatic is I look at their lifestyle. And one of the biggest things that can help is getting really good quality sleep. So we talk about sleep hygiene. So what do you do in that time before you go to bed so you're in a relaxed state, so you're more likely to get into a really deep sleep? So not being on screens, not watching Netflix at night until 11 o'clock and then crawling into bed and then trying to sleep, but you're still kind of wired, not being on your laptop and not being on your iPhone. All that will produce blue light, and any blue light from screens will stimulate cortisol at night. We really don't want cortisol to be high at night. We want it to be low. And the other thing blue light does is it blocks melatonin. So we don't want melatonin to be low at night. We want that to be high because that's the sleep hormone, and that will help us get into that deep restful sleep, which is really important for recovery and repair. And then I do suggest, if you do have to be on screens at night, or if you want to watch Netflix, then wearing some glasses like this. So these are blue blocking glasses. They're not sexy at all, but but that red tinge will block out any blue light. So sitting on the couch with your husband wearing them at night, or you can get the non-red ones as well, which aren't as effective, but they still work to some degree. And some other lifestyle things are things like limiting caffeine. So caffeine can just exacerbate like the hot sweats and the stress response, your body producing cortisol, and then producing more insulin with that as well. And then the stress management, it's the biggest thing I find. I talk to ladies about how do you manage your stress. We don't want to be in fight or flight all the time. With the business of our lives, with everything going on, we really need to get out of the sympathetic nervous system, the fight or flight nervous system, into the parasympathetic nervous system as many times as we can throughout the day. And we really have to retrain ourselves to do that, because it's so easy to be in fight or flight all the time and go, go, go. And we can do some really simple things to tap into the parasympathetic nervous system. And so they're things like deep breathing, or the Ujjayi breath that you do in yoga. The breathing in through your nose, hold for 10 seconds, out through your nose. If you do that 10 times in the morning before you get out of bed, so you enter into the day in parasympathetic nervous system, and then 10 breaths at night, so you go to bed in the parasympathetic nervous system, then as many different times throughout the day that you can fit it in. You can do it when you're driving to work or walking, then that will tap into parasympathetic and that will help. Then there's some other things like just being present in whatever you are doing. So if you're walking, using all your senses, what can you see, what can you feel, what can you smell, and bring yourself into the moment so you're present. You can be cooking dinner and being present, whatever it is. But if when you're present, you're not thinking about the future and you're not worrying about what's happened in the past. And then you're in more of a calm state. So doing these little tools every day can help. Another one is meditation. That's the big one that, everyone talks about. Not everybody likes meditation. So I talk about doing these other little things throughout the day. But meditation is amazing at being present and tapping into the parasympathetic nervous system. And then there's some other things that I talk about, like grounding. So stepping out onto nature. So we ground. So often we're around technology and we're exposed to positive ions from technology, but we need to step on or be in nature to neutralize those positive ions. And the only way that we can do that is by being in touch with nature. So something like surfing is amazing.
Yeah.
Yeah, so I really go deep into looking at people's lifestyle and talking about all those things that they can change to get out of that fight or flight and sympathetic nervous system mode.
Yeah. Which in reality, Matt, I find is really hard for the patients. You know, they're such like simple things and what we should all be doing as a baseline, that they're often the hardest things to get people to, they understand it to actually put into practice. I think we just live in a society which is so kind of anti this, and this itself is in total comparison to how we're, which is the whole point of it, comparison to how we're like leading our lives at the moment. You know, everything is do everything. Like as women, when you mentioned that, what we do in our 40s list, like we're constantly on the go and rushing around and supposed to be doing everything and set ourselves these high targets. And if we do stop, when we're doing this, there's often that fear that we are failing, or we're not coping, or we're not doing things, or we haven't got time to do that, and we've got to live in this rush. So you know, these lists I find or discussions about the stress reduction are amazing, and people take them on, but getting people to do it is so difficult.
It's really difficult, but I find it's like it's the thing that makes the biggest difference. If we would do them consistently, ongoing, then as we said, cortisol is made at the expense of progesterone. So we can't sustain making cortisol for our whole life all the time. We get burnt out and we become really symptomatic. So when we do implement these little things, it does make a big difference. And people notice after a while as well. They have a more calming effect, and they just feel better. But yes, I agree. You have to talk to the patient about what suits their lifestyle. And so sitting down for half an hour meditating, it's too much for a lot of people. They can't do it. They can't even imagine doing it. So that's why I talk about just doing these little things like the deep breathing in the morning, deep breathing at night, maybe a couple of other things that will also make a difference.
Yeah, fantastic. So what about nutrition? And tell me a bit more about nutrition during this time.
Yeah. Yes. Nutrition is super important. I recommend a high fiber, predominantly veggie based diet. I do advocate some animal protein in there for blood sugar regulation, but everyone's different and everybody has different philosophies. So I work with that as well. But I like also 3 meals a day, not necessarily any snacking. So 3 meals a day, have a good quality balanced meal with protein, fats and carbohydrates, and then don't eat for 3 to 4 hours. Let your blood sugar drop down, you go into fat burning mode, and then you eat your next really good quality meal. And then the same thing at dinner, rather than constant snacking, which will keep your blood glucose high and then high insulin, which can contribute to weight gain as well. Also adequate water, just to help with our detoxification processes. So it's really important to be detoxing estrogen and toxins and drugs and pesticides out of our bodies. And we need water to help flush our liver out. Also, not nutrition, but something else is dry brushing that I get my ladies to do as well. So that's where you just get a dry brush like this, and you just Google it, but you lightly brush your skin, and that will help move your lymphatic system around instead of it getting stagnant. And if you've got cellulite or a lot of cellulite, then that's an indication that your lymphatic system is quite stagnant. So dry brushing can help stimulate that. And then also reducing alcohol. So a lot of ladies in their 40s, or in general, but in their 40s, are going for the glasses of wine to help self-medicate in a way as well, because they need to calm themselves down. They think that they deserve it. So they're using that to self-medicate, but it's one of the worst things that you can do, because wine or alcohol in general is estrogenic, can make our estrogen even higher. And then it can interfere with the way that we metabolize estrogen as well. So if we have alcohol in our body, our liver will focus on metabolizing and detoxing alcohol out rather than drugs, pesticides, hormones, chemicals. So limiting alcohol as much as possible. If you are really symptomatic, that will help. That will really help.
That's great. And if these things aren't helping as much, or people want a little bit extra, there are some supplements that you recommend. Is that right? What supplements would you suggest during this time?
Yeah, magnesium is one of the first ones I go to because it's probably the most important one to help with a healthy nervous system. So if we do have those symptoms of being anxious, magnesium can really help have a calming effect, and it helps calm the brain and promote sleep as well. Then there's something called taurine, which is an amino acid which we can only get from animal products. So if somebody's on a vegetarian diet, I would definitely recommend taurine. And that also helps calm the brain down. And then B vitamins are really important because in times of stress and with a lot of things going on, we burn through our B vitamins. We use them up every day. So it could be an idea to have B vitamins to help with stress and help with energy. And then something called adaptogenic herbs as well. So it might be something like ashwagandha or rhodiola, or some of these herbs that are really good at nourishing the adrenal glands, which is where cortisol is produced. And they will help, if we're feeling anxious, calm us down. If we're feeling flat, lift us up a little bit. So there's a whole variety of those, and it really depends on the individual sitting in front of me and what is going on for them and what is their underlying condition as to what I will suggest for them. And then we have estrogen detox supplements as well. So things like DIM and calcium D-glucarate, which will just help our bodies get the excess estrogen out. So estrogen isn't as high. So there's not that gap between estrogen and progesterone. And then if people are having problems with weight gain and weight resistance, some things like cinnamon and inositol and chromium can help with the blood sugar dysregulation.
All right, great. Now, in regards to supplements, just on a bit of a side note here, where do you recommend people pick them up from? Because obviously, supplements can really vary in regards to what's actually inside them or what type. Like, might, for example, say magnesium, but when you look, there's lots of different types of magnesium, calcium. There's lots of different types of calcium, and we're aware that some of those are great and some of those aren't so great. Some are cheaper and some are more expensive, and usually, it correlates. Like in most things in life, the more expensive ones are the better ones that we should be using, and for a reason, because we absorb them more and they absorb them better and they work better within our body. But say someone's watching this today and they're not talking to us and wanted to pick up a couple of these, where would you recommend they go to get the best supplements?
Not from the supermarket.
Agreed. Yeah.
They're just really full of fillers and preservatives and the cheapest possible things to fill them up. So not from the supermarket. Always go to a practitioner, because there are so many supplements out there and you really can over supplement as well. And then if you've got any underlying condition, you need to make sure that it doesn't interfere with what that condition is or medication. So I would always see a certified practitioner and talk to them about what's going on, and they can suggest practitioner brand supplements. Otherwise, you can always go to a health food shop with somebody who is knowledgeable and just ask them what their background is. Like, make sure they do have some knowledge in the supplements that they're selling as well. But they're generally definitely better than the ones that you get from the supermarket. But even still, some of those aren't as good as the practitioner brand ones.
Yeah, definitely. And they're practitioner brand for a reason, because they've had the research done on them, they've been tested correctly, they've been made in facilities that are well regulated and audited by external businesses, so that they know that they've what's in them is right, and it has no other toxicities in them to cause problems. So yeah, that's good. I suppose on the other side, often women can get to a stage where, obviously, I usually say that it's a bit like coming off a drug. When you're on your hormones, and what we're doing during the perimenopause is we're coming off drugs. I mean, they're steroids that we're basically coming off. And like you mentioned, some women can do really well on that. Some women can really struggle. And we can provide all that background support, for example, through the supplements for symptoms, or to make sure they've got the right ingredients and they've got the detox ingredients. And the correct lifestyle, but sometimes women do still struggle. So the other thing, just as a basic, is then potentially having some actual hormones. yeah, which often we work on together. So on my side, if women are still struggling once they've got this background, then we can generally give them the hormones that they're missing and support their symptoms that way. I generally use what we call bioidentical hormones. So what that means is that if you drew the chemical out on a bit of paper, the chemical, the hormone in our system is identical to the hormone that we then take as a medication. And the theory behind that is then the body totally recognizes it as absolutely identical, and every process in the body that hormone then goes through is it's done streamlessly. It has nothing extra on it that might harm the body in any way or interfere with the body in any way. There's a risk with some medications that, for example, there's part of the drug will be recognized by the body because it fits a receptor to give a result, that the rest of that drug will look very different to anything else. So the body can then recognize that as a foreign body or something abnormal, or has never even broken it down before. And that's when there's the risk that it can potentially be a little bit more harmful or may cause a bit more inflammation or more side effects. So look, a lot of this is, I suppose, theoretical. There's, within my type of traditional medicine, there's no big studies out there to really confirm it, but there may never be, because a lot of these bioidenticals are compounded. So the research will never be done. But we are lucky at the moment, actually. Now there is an estrogen patch and a progesterone tablets that are commercially available, TGA approved, like any other medication, that are bioidentical as well. So we're actually quite lucky at the moment that those have come out. So yeah, generally I suppose we start using those if the symptoms, more for symptomatic control, and we try and use the lowest dose possible for the shortest period of time to support the symptoms. Yeah. And look, they can be a benefit as well. It depends on the woman. You know, some women, if they're going through this stage and dropping their hormones early 40s, that's a massive difference to somebody doing that at early 50s. And some women are more beneficial having the hormones in their system for longer, because it can reduce things like osteoporosis, like their bone strength. So some when we do start hormones regardless, purely just because of age as well.
Yeah. And that's why I love working with you, because I will do all the lifestyle, nutrition, supplement things, and unfortunately some women are still really symptomatic and they are suffering and they just can't function normally, like their everyday tasks. So then I refer on to you, and we talk about bioidentical hormones, and that can really make a massive difference for some ladies. And we're getting really good results with symptoms being reduced and them feeling good about themselves and feeling good within themselves as well. So I think HRT over the years has had such a bad rap, and that's more the synthetic HRT. But there's been so much research now around that, and now that we're using the bioidentical hormones, it's much more it's just exactly like it is in our body. So I would just like to say, don't be scared of HRT as well. Like, come and talk to somebody like yourself who does do the bioidentical hormones, and it can make a massive difference to how you live.
And it can benefit you as well. Like I said, there's people worry about taking the medication, and the biggest risk they worry about is the breast cancer. But the risk is actually really, really low. I think there's and it's actually beneficial. Like I said, it can protect you from things. So it can protect you from osteoporosis. There's potential chances that it can help reduce things like Alzheimer's and dementia, reduce your risk of cardiovascular events. So there's lots of benefits with it as well. So it's just having that discussion and that open discussion as an individual as to what works for you. But knowing your choices, isn't it, really, at this time?
And then testing as well. Like, we will always do extensive, like, blood tests, and I will do more extensive testing just to really understand what is going on for your hormones and make sure that hormone therapy is right for you, and which hormones as well. And then we'll monitor you along the way as well, rather than just going, here you go, and go off for the next 5-10 years and be on the same dose forever. Like, that's not how we work.
Yeah, definitely. No, that sounds great. Well, hopefully that helped a lot. So what would be your kind of final words for helping someone through this stage?
Yeah, that you don't have to suffer. Like there are all these options, and they're easy everyday options that you can do. It's unfortunately in our 40s, we probably have to be a bit more dialed in with all our lifestyle, nutrition and supplements. We can't, go and binge on the weekend with alcohol and things like that. You do have to be quite clean because otherwise you do get that you're more prone to getting these symptoms. But what you do in your 20s and what you do in your 30s can impact how bad or how easy or less your symptoms are in your 40s. Not that we're generally thinking about this in our 20s, but definitely in our 30s, our late 30s, we are starting to think about it maybe. So leading a clean lifestyle as much as possible will definitely help minimize these symptoms so you have a smooth transition in perimenopause.
Yeah, fantastic. So Mel, if somebody wanted to come and chat with you, if this has rung some bells and they realise they potentially could be struggling, how's best to contact you?
So I'm functional nutritionist on social, so through those channels, or I work at Ministry of Skin, so calling reception there and booking in an appointment through Ministry.
Amazing. Well, thank you so much for your time. It's been great to talk about the perimenopause. I'm a big advocate for this time. I think women are really undereducated on it. They're expected to just accept the symptoms and struggle in silence with them. It's something, as women, we don't even talk about amongst our friends. It might be a little bit of a joke over wine, but it can be really horrific and impact people's own life and their relationship. So it's great that we've got some information and some help out there.
No worries.
Yeah, thank you very much. See you soon. Bye.
Bye.